The newest tool on the market to address the dreaded cellulite is known as Aveli. Now first we got to address what cellulite is. Cellulite is caused by tethering bands that pull the skin down to create discrete contour irregularities or depressions. Now this is most commonly seen in the areas of the buttocks or thighs. So how does Aveli work? It's a small probe, it's smaller than a pencil. It's advanced underneath the skin in the areas where the patient has been marked preoperatively in the standing position. The red light lets the provider know exactly where the probe is. Now once these bands are encountered, the provider will notice that the skin is depressed, and a small knife will be deployed to cut those bands specifically in a very targeted fashion. In other words, we're not just blindly cutting tissue underneath the skin, but cutting exactly where we want to go to release the overlying skin. Now, these bands can occur in many different orientations, as you see in this graphic. Here's 3 different examples of cellulite in the buttocks and thighs, and you can see the orientation of the bands is very different, but nonetheless, Aveli can be used to address all of this. Here you see the device in action. So again, very small, thin device, thinner than a pencil. And the patient has been marked preoperatively, again in the standing position, to let the provider know exactly where we're trying to target, because when patients lay down, those depressions can disappear. And once the probe is advanced, again following that red light, the provider will withdraw the probe and we'll see that the skin is actually puckered where it's catching on those bands. Once that occurs, the provider deploys the knife, which cuts the bands and releases the overlying skin. It's actually quite a gratifying procedure because you can see in real time that band being encountered and cut, and can actually appreciate the skin popping out right then and there in the areas where the skin is released, thus correcting the contour irregularity. This procedure can be done as part of a larger operation under general anesthesia in the operating room, but can also be done under a local anesthetic in the office. In fact, patients can be comfortable enough to be using your phone, as you see here with this patient scrolling through social media. At the conclusion of the case, the patient's ready to go. If it's done in the office, they'll experience some mild bruising and some discomfort, but generally are pretty well tolerated as far as a quick procedure with minimal downtime. Results can be expected as early as a few weeks, but if you follow patients out several months, you can see these drastic improvements in the areas of cellulite, leaving patients very happy with a problem that has plagued women and men for years.